Good afternoon, and thank you for joining us for today's webinar. Today's presentation is being hosted by Transition Matters, a program of the Family Support Center of New Jersey, and presented by Lewis Hoffman, Program Manager and Travel Instructor at NJ TIFS, along with Cecilia Feely, Transportation Autism Project Manager at the Center for Advanced Infrastructure and Transportation, both with Rutgers, the State University of New Jersey. Before we begin, let's take a minute to go over how you can participate during today's web event. You each have your own control panel in the upper right corner of the screen that looks similar to the one here. Use the orange arrow to open or hide the control panel. To listen to the webinar, you have two audio options to choose from: mic and speakers, and telephone. If you can't hear well using your computer speakers, you can elect to use the telephone to listen to the webinar. In order to maintain the best sound quality possible, all but the presenters will be muted throughout the webinar. If you have questions or comments, you can submit them using the question panel. We will try to get to all questions at the end of the webinar as long as time allows. At this time, I would like to introduce our presenters, Lewis Hoffman and Cecilia Feely. Welcome, Lewis and Cecilia.
Hi, thank you very much. Today, Lewis and I are going to talk about transportation and travel training and what to consider during transition. Just a little bit about ourselves. I'm a transportation planner and engineer. I've been working in the field since 1998. And I'm also the parent of a 15-year-old son with classic autism.
I'm Lewis Hoffman. I'm a travel instructor for NJ TIFS at Rutgers. And what we do is we teach people to travel independently. My background is I was a social work student at Rutgers. I actually worked with Cecilia doing a research project on autism a few years ago. And we are currently working together to get her some participants in a current study. I was a social work student at Rutgers, and I graduated with that, and now I work for Rutgers in the Blastein School of Planning and Public Policy. My background personally is that I have a sister with a cognitive disability who is older than me, and I've been just inspired by her life. So it really inspired me to become involved in the field of working with people with disabilities, and that's why I'm a travel instructor.
So we're going to talk about why transportation is an important part of transition. To really get anywhere, one needs to know how to travel independently. If you want to go to work, school, the doctor's office, to the store to get some food, anything, social activities. And transition is an optimal time to educate an individual on their transportation options. The options are going to be different for each individual, given their skills, their interests, what they can handle, what they can't handle. We'll discuss some of that down the road, the different transportation modes that somebody can take. It's also going to be affected what's in their community. Different communities in New Jersey have different options. If you live in an urban setting like Jersey City, you might have access to the PATH train, the bus, the light rail, jitneys, and you have a lot of opportunities to walk to most of your destinations. If you live in a more rural part of New Jersey, say Sussex County or down Cape May County, you might not have as many transportation options, and it might be difficult to walk to your local store even. So it's really important both to have that transportation taught during the transition period, but also to what the person has within their community. And when the person ages out of school, there's not as many opportunities to have that transportation programming. There are some, but it's much more limited. You don't really have the same backgrounds. You don't have the level of occupational therapists, speech therapists, PTs in the adult services world as you do in the school setting. So that's really some optimal supports during the transition period. And the pre-travel skills that we're going to be discussing today can be taught at home and at school. You can do simple things such as teaching somebody how to contact you when they get to their destination. If you have a teenage son such as I have, or a teenage child, you can have them, if they're going to visit a friend without you, if they're going to go to school or do some activity and you're not present, just have them text you that they've arrived safely at their destination. Simple things like that can be built in. Maybe take a picture and send it to you if they have trouble typing, that they've got to their destination. Teach them how to use a phone, how to text somebody or call somebody in case of emergency. Those simple skills can be taught, or even to show identification to somebody if they get lost or confused. If they might not be able to verbally say it, they can transfer that information to somebody who can help provide them service. And why is transportation so important? Adults with developmental disabilities, such as autism, such as being on the autism spectrum disorder, they have the same basic needs that we all have. They want a full social life, a working life, access to their family and friends, and access to services like healthcare, shopping, learning opportunities, vocational training, and recreational activities. And the essential link that ties these together is viable transportation, but it's often overlooked. People might say, oh, I want to go to this day program, or I want to do this recreational activities, I want to go to the movies. But if you don't think how you're going to get there, you're going to have this barrier built in. And some of the research that we've been finding here at Rutgers on transportation during the transition age, we found that transition period of one's schooling is really the critical time for learning transportation mobility skills. As I said 2 slides ago, that there's really not this supports built into the adult services world. There's the little opportunities, very limited trials. At school, you might be able to do it every day for 180 days during that school year, with even supports during the extended school years, but you really don't have that. It's going to be much more difficult to have those trials in the adult services world. There is a big dichotomy in New Jersey with areas that do have access to transit. New Jersey Transit, because with New Jersey Transit you also have the access link built in if you're near the New Jersey Transit bus services, and areas that you're outside of 3/4 of a mile to a bus service. So if you're outside of that transportation service area, you really are much more limited. There are other options that we're going to discuss in a couple minutes, but that's with our research that we've been conducting in New Jersey, that's a big difference where people live. And we also need to educate the public about adults with disabilities. So if they are on the bus, or if they are on walking to the store, on the bus, on the train, or even driving, that people recognize the individuals and that there's nothing wrong with them. They just have autism, or they just have a developmental disability, and they're fine and they're functioning fine. And the families and caregivers often see this population as vulnerable, and they can be the barrier deterring independent travel to these individuals. So a lot of times the families and caregivers need to be able to let go and encourage that independence, because a lot of times they can rise to the challenge, and we'll be talking a little bit about that later in today's presentation. And we do realize that there is training that is required for the vehicle operators and the frontline staff. So somebody might not be able to verbally communicate something, but they can show it on their cell phone, iPad, or even just have a written note card of what their destination is, or written note cards, or some other way to convey information to these operators or frontline staff.
Yeah, the earlier people get used to using the bus or the train, or get used to traveling in their own community by themselves, the more easy it's going to be for them, the more easy it's going to be for the parent who's already gotten used to how the person behaves in the environment, and the more used to it the staff is going to be, because they're going to know the needs of not just what any person with autism might need, but they're going to, a lot of the people out in the environment are going to know the needs of your specific individual. So that's very helpful.
Which brings us to moving towards personal responsibility. As we said, there's part of it's encouraging the young adults during that transition age to start doing things for themselves. A lot of times the parents, and I find myself doing it as a parent, we often feel like we have to do so much for the individual. Sorry, we're just getting a little feedback. So we need to make sure that young adults are able to start with their independence.
Cecilia, it's Melanie.
Wake up with an alarm. Hello?
Cecilia, it's Melanie. I'm going to actually ask you if you click on the audio button on your control panel. Do you see the control panel?
Yes.
Actually, it may have cleared itself. Try speaking again. Cecilia?
Yes.
Okay, it actually cleared itself up. Yep, you're good to go.
Okay. Okay. Thank you, Melanie. So it's important to teach that personal responsibility for the young adults. As they are in the community independently, they're going to need that personal responsibility. And some of the things you might be able to start doing at home or at school would be having them learn to wake up with an alarm clock, plan trips to the movies by themselves, and take the bus independently or take Access Link or a community paratransit vehicle there independently. Often we do other things for the young adult with a disability rather than letting them do themselves. Like they can prepare the lunch. Rather than me preparing the lunch, they can prepare their own lunch. Instead of the teacher writing the lesson plan or making the notes about what the homeworks do, they can start doing that themselves. They can prepare the book bag. Rather than the dad driving them to the movie theater, they can figure out how to get there independently. Or go to the local movie theater where maybe they could walk. So really start looking where you can take on more personal responsibilities and give it to the young adult.
Okay. So New Jersey is an employment-first state, as a lot of us have heard. And so employment is something that a lot of us are going to be building towards, some type of employment. And we need to map the way to that. Now, people with disabilities have an employment rate of 33.5% compared to 76.3% of people without disabilities. That's a pretty big gap. Now, what percentage are unable to find or maintain a job because of an unreliable transportation? Well, there was a disability survey done by the Blaustein School, which is my parent organization, and what they found was that 76% of the respondents of people in New Jersey with disabilities felt strongly that transportation was important during the job search. 40% had to refuse a job due to travel difficulties, and then 25% reported leaving a job due to travel difficulties. So really, it's a big barrier to employment, but it's also a barrier to a lot of other life-affirming activities as opposed to just things that we need to do, like going to the doctors or going to the job. So it's going to be a barrier in a lot of areas if transportation is an issue.
And another barrier often can be cost and expenses to different transportation options. Car ownership is really very expensive and might be cost prohibitive to a lot of people. Aside from the responsibilities for car ownership, the expenses can be gas and maintenance, making sure everything is working okay. I know a lot of people are getting flat tires with all the potholes. Those are huge expenses for a person to have to suddenly take, and a huge responsibility, because if you don't get these fixed, you're not going to have your transportation. You have insurance that you need to make sure you have and is maintained, registration, inspection. There's a lot of expenses and a lot of responsibilities. So it does, usually the first choice that most of the young adults want to have, both with disabilities and without disabilities, but there are barriers, and as we'll talk about in a minute, the individuals with disabilities are not driving at the same rate as their peers are. Public transportation and paratransit services are a lot more reasonable in the cost. And in some ways, there are a lot less responsibilities for an individual to have. Public transportation, the bus, the New Jersey Transit bus that might come by your neighborhood, you really just have to look at the schedule, make sure you have the fare, and have the schedule and be at the bus stop to get to your destination. You just have to have that information how to get there. The paratransit fare could be a little bit more expensive. There are some county services that are fare free, but oftentimes you do have a little bit more responsibility because you have to reserve those services ahead of time, and you have to cancel if you decide you're not going to go within, some of them are 3 hours prior to your trip, or else you're going to be suspended from the service, or you might not be able to use the service anymore at all. And walking is really the most affordable. It's free, and you also get health benefits from walking. But there are difficulties, and in some areas you might not have proper sidewalks or access to sidewalks, or you might have not have a destination that's someplace that's within a reasonable walking distance. So we're going to look at some of the mobility options that we have in New Jersey. The first one always seems to be driving. The second one is paratransit, and we're going to look at paratransit and ADA paratransit. And in the United States, usually they're one and the same. I should actually say North America. If you do travel elsewhere, they're pretty much two different definitions that we'll get to in a minute. And we have taxis, which are also very expensive and usually a last resort for most people. You have the local bus and the interstate bus. You can see the difference. The top picture on the left-hand side is the local bus, and the interstate bus is or commuter bus is the middle picture on the left-hand side. We also have rail and light rail subways in New Jersey. You have shuttles. You do have some jitneys in certain areas that we don't have listed here, and people can get around by walking or bicycling. So we're going to go into the first one for a couple minutes, driving, because that is the choice that a lot of individuals want to do. There are some barriers to driving. Research indicates that for adults on the autism spectrum and with developmental disabilities, it's approximately 25 to 30% that are driving, and that's the 3 studies that we've been able to find that are looking at driving. But a lot of the young adults say they do want to drive, and for a lot of New Jersey, that is the easiest way to get around. So if you're not sure about driving is right for your student or your child, there are certified driver rehabilitation specialists that can work with you. They can do a pre-driving evaluation to see if you have the skills today, the cognitive skills and the other skills that are necessary for driving. They can do a behind-the-wheel evaluation to see if you actually do have the skills and the reflexes that are needed. They can assist with driving lessons. They can give individual driving lessons or assist with driving lessons. They will even take you to the Division of Motor Vehicles for a road test. And they can refer for special services. And collectively, they're good. They're really good things, these certified driver rehabilitation specialists, because sometimes a parent or a service provider might either think that the person has more skills and more abilities than they really do have, or the person truly has more skills than the parent is recognizing, and they can be an independent evaluator to see what skills the person really possesses at that moment in time. And you can remember that even if your young adult doesn't have those skills today, they can test again in a couple years. Maybe they're not ready at 16 or 17 like their peers, but when they're 21, 25, they do possess those skills. They do have the cognitive abilities or the motor planning skills necessary to drive a vehicle. So, and this is a good way to do it, an independent third-party trained professional to look at the driving. And if you do want to work with a certified driver rehabilitation specialist, you do need a prescription from a medical personnel, a physician, stating, and the key words are usually a driving evaluation and training as necessary, because they cannot work with you before they get this. They would also like the people to possess a valid permit. A lot of times parents or service providers have told me that they tell the young adult, you want to drive, you will go get your learner's permit yourself. And if a person can take that much initiative and that much responsibility and is taking driving that seriously and can get that, then you can take them to the next step with the certified driver rehabilitation specialist. And then once you get that permit, then you can, and you have your physician's script, you can bring it to the CDRS, schedule an appointment. They're all specifically trained for driving. They're not just a regular drive instructor. They're a much higher level. Some do specialize just with seniors and just with the TBI. We're going to get to the next slide showing that the ones we do know in the state, we have 3 that we know of personally that do work with young adults with cognitive disabilities and developmental disabilities. But some might specialize with seniors. Some might specialize with traumatic brain injury. So make sure that the CDRS that you're going to be working with knows how to work with the population and has experience working with the population of your young adults. Many of them have an occupational therapist background, and then they specialize in driving. And for certain individuals, if you do need some kind of vehicle modification for your driving, they can assist. They can either help you get that done or provide you with somebody who can make those modifications for you. And the certified driving specialists that we have met with that definitely work with this population, the stars are where stars that you can see on the screen are located at the 4 locations that do. The 2 north ones are Kessler Institute for Rehabilitation in Saddlebrook and West Orange. The Bacharach Institute for Rehabilitation is in Pomona, and that's just outside of Atlanta, just north of Atlantic City. And then the St. Lawrence Rehabilitation Center in Lawrenceville. And those work with young adults with developmental disabilities and cognitive disabilities. If you live in the other areas of the state, you see the 3 blue question marks. Those are other ones that there's only 7 certified driver rehabilitation specialists in New Jersey. And these are the 7. We don't know personally if the other 3 do have people that are trained to work with this population. But we've given you these options, and you can contact them to see if they can work with your individual. Next, we're going to talk briefly about paratransit services. Paratransit services is a blanket term for many different types of shared transportation. They are public transportation, and they're utilized often by disadvantaged population, which would be people with disabilities, older adults, seniors, and low-income individuals. These are not fixed route, but they are public transportation, and they are not personal vehicles, and there will most times be other members of the public on those vehicles. There are some systems that are open to the general public, and you don't have to be one of those 3 categories, and you can use it, and it's open to the public. So families and service providers need to be aware of that. This is a public vehicle, and they will be interacting with other members of the public. The drivers are not specially trained to work with this. They do have training to work with people with disabilities. They do not have the same level of training as somebody who would specialize in working with somebody with a developmental or cognitive disability. These paratransit services usually fall into 3 general terms. Curb to curb, which is that the vehicle pulls up to the curb. It might be the parking lot, the curb. Some facilities, if you have an overhang, they might not be able to get that close to the building. Or if you live in a complex where your parking lot is not very close to your door, they'll just come to that curb. So you do have to be aware of them. They do also have door-to-door, which they'll come, the driver will come, ring your doorbell, let you know they're there. And there's door-through-door, where they'll actually come in and assist the person out of their home or residence or facility onto the vehicle. That's not very common, the door-through-door, that level of service. This is the the United States, North American definition of paratransit services. Elsewhere in the world, paratransit services also could include taxi cabs, jitneys, rickshaws are included. So if you do travel outside of North America, beware if you're going to be asking for paratransit services that they're not the same as what we have in the United States. or the definition is much broader than what we use in the United States. And the types of paratransit that are available in New Jersey. The one you might see the most often is Access Link, which is actually the two pictures on the bottom of the screen. The Access Link shuttle that you often see around New Jersey, or the sedan. In New Jersey, all 21 counties have county paratransit providers. And many municipalities also have paratransit services. There are prerequisites for using these paratransit services. Many of them you need to file an application to even be eligible for the service. Some of them you need to go for an in-person interview, which often they'll come and pick you up on that vehicle so you can get to the location for the in-person interview. Many of them you need that doctor's referral form, or a special, either they'll provide you with a form that your doctor will have to fill out, or you'll need a script from your doctor to use the service. Some of the services require a Medicare card or an SSD card, and some of them, not many, but a few of them might require some financial information to show that you do need these services.
Now these are some tips for preparing an individual to maybe get travel instruction or maybe travel independently in some way in the future. For pedestrian skills, I always encourage people to introduce individuals early to traveling in the streetscape. A lot of individuals end up riding in a car most of the time for most of their trips and really don't get that experience of actually looking and being out on the street and navigating in any way and wayfinding. So we encourage people to walk in your own community, to learn the community first, because that's going to be the place that likely they will travel the most. They'll probably start a lot of their trips in that local community. So it's good to learn the ways around, the places to go in case of an emergency or in case you need help. And, you know, it's important to find routes. What are the best routes from my home to the local grocery store or to get to maybe even a bus stop? You want to look for the safest routes instead of the shortest routes. And when I'm working with individuals, I often encourage them to participate in that process where they're figuring out which is the safest way to go, as opposed to just how do we get there the quickest. But work on street crossing and intersections. Make sure that there's, you know, eye contact going on, eye contact with drivers when drivers are stopped for them, and that they're not just following the cues of whoever they're walking with, because a lot of times people it may feel like they are traveling independently, but really they're following the cues of either other people or people like yourself who might be helping them. And then, of course, we want to introduce levels of independence when they're appropriate. So if we see that that person is really able to walk and navigate those street crossings, you know, on their own, maybe send them out on trips and shadow them, you know, walk behind them a little bit further so you can monitor what they're doing. But I think that's a good way to introduce some of those skills in order to prepare them for really traveling independently once they're of a certain age or of a certain independence level. Now, there's a lot of fears associated with riding public transit. Public transit, according to this particular survey, was the fourth most common fear that people had. And also some of the other fears that might be related are crowds, closed places, tunnels and bridges, going out by yourself, speaking to new acquaintances. Any of those things are also involved in traveling independently. So a lot of those are on the list. So even if you don't have the fear of public transport or there isn't some sort of stigma against public transport in your mind, you still might have other fears, or the individual might have other fears or other anxieties about going on public transit. The key reason people don't use public transportation is fear, in fact. Experience can prevent that fear. Building that awareness from an early age, you know, getting to know the local bus system in your area and some of those drivers is a big barrier buster. You know, that'll stop that from getting in the way as much. And knowing what to do in certain situations can also remove fear. Build and use those supports to assist travel in the future. More support may be needed at first. It's always important to offer that support and have a long time to introduce these skills. You don't want to be thinking, well, my kid's graduating in 6 months, you know, maybe we should start introducing some of these skills. Not to say that it's not possible to do it then, but it's much better to introduce it as early as is possible. Some will continue to need support, and some people won't be able to travel really independently, but they should strive for as much independence as possible. But when people start looking for long-term jobs, fixed route options should be kind of the first place to look. Now, I'm a travel trainer, so I want to introduce you guys to what travel instruction and travel training is. Well, who does a travel trainer work with? Normally, travel trainers work with people with disabilities, seniors, and other individuals, other transportation disadvantaged individuals. What do? Well, we teach people to use public transportation and to travel independently and safely. Where do we do it? Well, we do it wherever the individual is. That would be usually starting from their home and going to wherever they need to go. We don't travel, you know, on some random route that we pick. We travel where the individual needs to learn to go. And why do we do it? Well, to increase independence and self-sufficiency, self-actualization. And when do we do it? Well, that's a really important question. We do travel training at transition points in people's lives. So that could be the transition from high school to adult life. It could also be the transition into college or out of college. It could be the transition into some sort of disability if a person has an injury of some sort. It could also be the transition away from driving when people get later in life. So those are really the times that we would do travel training, when it would be appropriate. Now, the formal definition of travel training or travel instruction is a spectrum of services used to introduce and teach people with disabilities, seniors, and others the skills necessary to travel safely and efficiently within home, school, and community environments. Now, you might wonder about how long has this been going on? Well, travel instruction has been going on since 1963. That was the first recorded travel instruction. And the program was started at the AHRC in New York City because they had a day program there. And the parents were traveling with the individuals to the day program on the New York City subway. And because some of them were coming from outer boroughs into Manhattan, they had really long trips, and they would not go home in the middle of the day. They'd just stay there and wait for their individual to be done at the day program. And really, they were giving up their own lives in order for these people to go to the day programs. So the AHRC said, maybe we could teach some of these individuals to use the subway, and they actually had a remarkable rate of individuals that they were able to get to travel independently. Some people who were really considered to not be able to learn skills like this. So they started that in the state program model, but then it moved into the New York City Public Schools in the late 60s and early 70s, the Allegheny Intermediate Unit, and other school-type agencies have been doing it for a long time. But really, travel instruction is funded and delivered by public transit agencies who usually do shorter-term models with individuals, and sometimes they do group orientation or familiarization, also by schools, and also by nonprofit and for-profit organizations. Now, to give you a little history on who I am and what NJTIP is, we're the New Jersey Travel Independence Program. And we had a successful pilot program between 2005 and 2007. We became a separate nonprofit in 2007, and then we had 8 years of successful travel instruction. We're the only provider for New Jersey Transit, where most of our training is concentrated in the northern part of the state. I'll go into exactly which counties we provide service in, but of course the services would also be offered at a fee-for-service basis if people need it outside that area. And recently, in 2013, we merged with part of Rutgers with Voorhees Transportation Center, which is a transportation research arm of the Blaustein School of Planning and Public Policy at Rutgers. Now, you might wonder what services we provide. Well, NJTIP is unique in that we provide most of the spectrum of travel training services. We provide one-on-one travel instruction. This is usually over a course of months. Some schools and other entities might do one-on-one comprehensive travel instruction over the course of many years. NJTIP is not really set up to do that level of travel instruction, but our travel instruction usually takes place between 3 and 30 sessions, and sometimes more, depending on the need, over the course of months. Then we also offer small group travel training and familiarization, usually in agencies, and we'll familiarize people to local routes via the agency or do classes at the agency. We also work in schools and we'll do classes with the transitioning students. Additionally, we will do Connect to Transit seminars where we will work with professionals to help them understand the transit system in the area and a little bit about travel training and how to approach that. Okay? To give you a little background on our one-on-one model and how we actually do the travel training, first we meet people for an introduction to NJTIP at Rutgers, and we usually meet them based on a referral of some entity. We also do an intake interview where we go to the individual's house and actually speak with them and maybe a parent or a guardian or some other counselor who may help them describe what are their needs, where do they want to travel, and what might some of their barriers be in the area. And then I actually go out, or one of the travel instructors will go out and do a route check or an environmental analysis. And usually when I do that, I look at more than one route. I look at the route to find the best route for the individual. It might be the shortest route. It might be a route that is safer, or a route that means they don't have to cross as many streets or not as many big streets. Sometimes we work with parents to drive them to a certain location where they can pick up fixed route transportation for a longer trip. So there's lots of ways that I'll do the route check, and it's usually a collaborative process with the families that we're working with or with the individual, where we can find out what's going to work best for them in real time. And then we actually travel at the times they really travel, as opposed to just doing it whenever might work for us. We do it, at 6 a.m. when they have to leave for work and travel the trip back at 5 p.m. So whenever it is that they need to be out in the field, we'll be out with them. We do these on-vehicle instruction sessions, and we build to a mastery of 27 independent travel skills, which I'll discuss a little bit in a couple slides. As people master these independent travel skills, the travel instructor fades back and shadows the individual so that they're actually doing the traveling on their own. And sometimes we actually have another travel instructor come out and do the shadowing for us so that we're really not giving any of those cues to the individual that might be helping them to travel not actually independently. So we actually send out someone else so that they don't know that they have that they're being supervised in that way. But we coordinate with them or with the families in order to do that. And then, of course, we offer retraining as the individual might need. Now, I have an individual that I worked with and a couple of our other travel trainers worked with in northern New Jersey. And she was off of a train route. And that train route, as you can see from the picture here, has steps up to the train. So this is one of our non-level boarding stations in New Jersey. And so it didn't have the symbol of accessibility on it, and no one really knew that they could use this to board the train, this particular station. Well, we introduced the individual to the train, and she was able to walk up the steps, and so were a lot of the other people that lived near her. She actually taught quite a few other people about the train and where it went. But what she was able to do is she's an individual that has 4 different jobs. 2 of them were volunteer, and 2 of them were paid, and they were all different days of the week. So she didn't have exactly the same schedule every day. she had to go different places on different days. And so she would take the train down to a major transfer station, which in this case was Ridgewood, where she could make transfers to other trains, to interstate buses, and also to local buses. So she was able to make those transfers and get to lots of different places throughout the area. So it's not just about where the line that goes by your home goes, but also where all those transfers go and all the variety of places you might be able to get to. And really planning and honing where you can get to is something that the travel instructor collaborates on the individual with. And we've actually worked with Diana a few more times as her job needs shifted and as she needed to, adapt her trips a little bit. But she also does quite a bit of trip planning herself too. Just to tell you a little bit about some of the ways that we measure how people are doing and how people might do during travel training. We do a pre and post test, and then we test people each time we go out travel training on 27 different skills that they need to have in order to travel independently. Some of those skills would be wayfinding, appropriate social skills, interacting with the appropriate types of strangers, safe street crossing and intersection analysis, handling the fares and paying fares and buying tickets, and interacting with the bus operator or the conductor. And then, of course, boarding, signaling, and exiting, which are all the parts of the actual physical bus or train trip. So as we test people on those skills, we do it at first to see what their kind of baseline is, and then we hopefully get people to a place where they're able to travel completely independently. We have a very good rate of getting the people who start our program to finish and be independent travelers. Now, just to give you a little bit of background on where our services are available, we will work anywhere in New Jersey on a fee-for-service basis. And we also have funding that's generally concentrated in the northern part of New Jersey. So that's Essex, Passaic, Somerset, Morris, Union, Hudson, and Bergen. Those are the places where we have one-on-one travel instruction available to people. Upcoming, we have some travel instruction programs coming in Middlesex, Mercer, and Burlington, and we're looking to expand into more parts of the state as funding is available. Now, we also work in schools. Sometimes the schools pay for us to come in themselves, and sometimes we have other funding to come into schools. So if you're interested in maybe your school having us come in or provide some type of travel training, that's another avenue you can go to. This is a picture of me with a group of students at the Metuchen train station, and I'm introducing the train schedule and the train map to them before we actually went out on our trip. Now, what are our rights as ADA riders? So we talked about how we want to have rights when we're in cars, how we might want to have rights when we're on public transportation like paratransit. But this is really the public bus or the rail system. So we should be able to use any public bus or rail system. Now, some systems have older stations that have not been updated that were in existence before the ADA Act was passed. New Jersey Transit updated many of their stations, the ones with the most ridership, the key stations. They updated those to become completely ADA compliant. But there still are some stations that are not accessible to somebody with a mobility disability. So if a person has a hard time walking up steps, you want to look for this symbol of accessibility that's in the left side of the picture. You want to look for that on a rail map to make sure that you have that level board and that accessible service at your local train station. You can request route and service information. You can stand on a lift on a bus if you can't use the steps. So that means that you don't have to have some sort of mobility device. You can just ask, can I use the lift? And they should deploy and use that lift for you. Expect that all this equipment is really up to date and works. Travel with or without a personal care attendant at your leisure. Receive courteous and respectful assistance. The ability to file complaints with transportation providers if necessary. Personnel also should have received ADA training to understand the Americans with Disabilities Act and not ask you inappropriate questions about your disability. They should know how to deploy the lift and kneel the bus. They should obtain the bridge plate on the train and assist with boarding and deboarding if needed. There should be help asking passengers to move out of seats that are supposed to be for persons with disabilities. And, of course, calling out your stop, letting you know when your stop is coming up if you ask for that. And confirmation that this is the correct vehicle that you're supposed to be on. Now, as far as self-advocacy goes, we need to ask for what we need. We shouldn't expect that people just do things for us. A lot of disabilities are not something that people are going to know right away. What exactly do you need help with? So you need to ask and explain, I need this. And you don't need to explain that I need this because I have autism or I need this because I have a developmental disability. You can just say, I need this help. And if there's any further issue, you just say, you know, you're violating the Americans with Disabilities Act if you can't, you know, deploy the lift for me, even though I don't have a wheelchair. And then you disclose enough to ensure that you receive the required accommodations. So you want to make sure that you tell them, you know, what you need and what exactly you need help with. And you're never required to release information about disability. But a lot of this, you know, cutting the cord and helping people become independent, this can be really scary, especially for parents and for teachers. And part of doing this is the dignity of risk. Individuals should be able to, you know, achieve their greatest, the greatest amount of independence they can. So take the early steps, focus on the strengths of the individual, and of course allow for mistakes because that's the way we learn the best. And it doesn't happen in a vacuum. I work with lots of different professionals and with parents. It's really a team effort to get the best outcome for each individual.
Before we finish and ask questions, we're just going to go over some current research that we're conducting here at Rutgers. We've just started a statewide survey. We did the launch this past Friday, May 30th. You can see the link there. The survey is for adults on the autism spectrum. It can be any of the autism diagnosis, DSM-3, DSM-4, DSM-5, but the individual has to be 18 or over. For individuals that can't do the survey themselves, parents and guardians can take them for that person. We really are looking for what modes you use, how you travel, how you learn to travel. Are you getting to where you need to go, and are you missing opportunities due to transportation? Or as the story that Louis gave a couple minutes ago, is somebody else missing their travel opportunities to bring you to where you need to go? And we're looking to find out from this population where they learn to travel independently. Additional research we're going to be conducting at the end of the year is we're going to work with Melanie, who's hosting our call, is to have some focus groups. We're looking to do 2 focus groups with individuals on the autism spectrum and then 2 with the parents and guardians of those individuals. And they're going to be broken up for the urban, suburban areas in New Jersey that have access to New Jersey Transit and Access Link. And then more rural or suburban areas where there is no adequate transportation in that region. And a separate study that we're doing currently is a paratransit assessment. And in this one, we broke down the 37 different skills that an individual needs to use a paratransit service like New Jersey Transit, Access Link, or their local county service providers such as the MCAT shuttle. And we're looking to interview 30 individuals to see that are currently using these services to test their skills. So if you have any questions or comments, I'm going to turn it over to Melanie, and I'm going to just put up our contact information. So if you're interested in either of those, our current research, or if you'd like to get in touch with Louis for some travel instruction and travel training, I'm going to leave that slide up while we do the question and answers. So I'm going to turn it over to you now, Melanie.
Cecilia, Lewis, thank you as always. We do actually have quite a few questions coming in. The first is Access Link the same as county transit? And if not, what is the difference?
Access Link is run by New Jersey Transit, and it's within a three-quarter mile buffer zone of the local bus. So that wouldn't be a commuter bus that goes to New York City, would not be the bus that it buffers. It has to be the local bus. And for Access Link, then you have to do an eligibility process. I think it's the strictest of all the services compared to the county. The county paratransit in New Jersey, each of the 21 counties gets special funding for paratransit services for individuals with disabilities and for seniors. We have special funding called the scatter tap funding, and those are local county services that will provide, it might provide to a day program, to the doctor's office, to shopping. The one difference is between New Jersey Transit's Access Link and the county services is that the counties can prioritize trips. So if you have a trip to go for a medical appointment, they would get priority over somebody who's just going to a shopping appointment, or if you're going to a hairdresser or something like that. New Jersey Transit's Access Link does not prioritize trips. So that's a first call, first serve. You do have to be found eligible for it, and they do have a determination process, which you can find on their website. And I don't know if Lewis has anything.
And the counties can also go outside of that three-quarters of a mile area around the bus route, so they can serve areas that might not be served by Access Link.
Yeah.
Perfect. Thank you so much. So the next question that we have is, what if a driving evaluation comes back that a person is not able to drive? Are there other options available to someone who has a physical disability other than Access Link, which is expensive and the person is not close to public transportation? Any suggestions?
If the driving evaluation comes back, usually they can recommend skills that a person needs to work on to be able to drive. If it's a physical disability, they can usually work with the CDR. I'm going to get these initials wrong.
Is it the CDRS?
The Certified Driver Rehabilitation. Hello? The Certified Driver Rehabilitation Specialist can tell you the skills that you need to work on. If it is a physical, they might be able to make some modifications to the vehicle, to your individual vehicle. These will be expensive as well. They should be covered. But sometimes it can take a long time, and if something happens to that vehicle, you might not be able to use another vehicle if you do get the modifications for people with physical disabilities. But they can tell you why you aren't ready, what skills you can work on. You can either work on with an OT or just a regular driving instructor. You can work on those. But outside of the New Jersey Transit's Access Link and the county shuttles, there's really not that many options that are affordable. Those are pretty affordable services as compared to a taxi cab or some kind of for-hire service.
So Cecilia and Lewis, we actually have from a different question from another attendee. And Cecilia, since you mentioned the CDRS, I do want to ask it now. We have someone who wants to know what types of modifications for a car can be done at the recommendation of the CDRS.
Well, most of those modifications are for people with physical disabilities. You might have adjustments to your steering wheel, adjustments to your dashboard if you can't reach, if you do have problems. If you, they can make modifications for people who are in wheelchairs. So if they couldn't physically do the pedals, they can adapt the pedals. But a lot of these are very expensive. They can, if you're in a wheelchair, they can make it so you can have your wheelchair be the seat that you sit in. There's a lot of modifications. I don't know that many modifications they make for people with cognitive or developmental disabilities. But they would work one-on-one with that individual on what they need to make those modifications.
So thank you again. Are there any legal concerns regarding liability that need to be considered for guardians when their child who has a cognitive developmental delay is driving?
Well, as far as liability concerns for driving, I would think that they need to make sure they have a high rate of insurance. Like they have to have a good plan behind them. That's certainly the biggest liability thing you could do.
And for other things, you could have, if they get pulled over, if there's some kind of situation, you could have some of the individuals that drive might carry some type of card.
Mm-hmm.
So if their anxiety goes up, because I know my anxiety goes up every time I've ever stopped, or the few times I've been in an accident, your anxiety skyrockets. And if it gets to that point where you're not able to communicate or really function, you could provide that information to the police or to a responder that this is about the individual, but they might not be able to communicate. If they have a cell phone, if they can write some notes or something, maybe they can communicate that way. But it's also to prepare them, because those do happen, and they happen to everybody when you're out on the vehicle.
I think familiarizing people with the police and law enforcement in any of these situations is a really good idea. Meeting a police officer, knowing what you need, making sure you have proper identification and can explain or show something with your disability on it. Thank you.
Thank you.
And at what age can a student travel by themselves via Access? And how do we contact Access Link to schedule a pickup and return ride home?
Could you clarify that? At what age can they travel independently on which program, Access Link? Or?
Yes, via Access Link.
I think the age of Access Link to travel on Access Link is 5 years old. I would confirm that with them. I would call Access Link at 800-955-2321 and just follow up with them and see, you know, what you'd need to do for that individual to travel independently on the Access Link. We don't do travel training on Access Link vehicles. We teach people to use the regular fixed route, the bus, the rail, the light rail.
And for the return destination home, you usually would, when you schedule your trip, you should also try to reschedule that return home trip, because the trips for Access Link do need to be booked up at least 24 hours in advance. So you can't go out and then decide, oh, I'm going to get home then. They're not like a taxi service. You have to, usually we recommend scheduling them at the same time, your departure and your return trip. Thank you.
What types of transportation do you recommend for youth with disabilities in rural southern New Jersey?
We don't do too much work in rural southern Jersey, but I would say certainly call your county and your municipality to see what options they might provide. I know of another system in, I think it's Cumberland County and maybe Salem County called Pearl Transit, but I know there are lots of different programs that do different sorts of transportation. There's also shuttles in a lot of these areas that aren't necessarily run by the county, but they might be run by your local transportation management association. In South Jersey, that's Cross County Connection. So they might also be able to help out with other transportation options in your specific area. All the areas in New Jersey have a transportation management association or a TMA that serves the area that can give transportation information.
Perfect. Thanks so much. So I think we're going to have time for maybe 2 more questions, maybe 3. How would a transition student obtain a referral for NJ Tips one-on-one services?
You would call up me, and we could discuss where the individual lives and what services we have in the local community. So you can call up NJ Tip, or you can call my phone number that's listed right there, or send me an email.
And also, if you if you sign up for Access Link, somebody from NJ Tip for your eligibility screening, somebody from New Jersey TIP will be, NJ TIP will be present for that. So most of the region.
If the people are in certain regions of New Jersey Transit, that might be true. I would call NJ TIP. You know, we're also one of New Jersey Transit's accessible services. So if you call up NJ Transit, you can get more information about what travel training services might be available through New Jersey Transit.
Perfect. Access Link is an out-of-pocket expense. What are the non-out-of-pocket options?
Every type of transportation will require out-of-pocket expense, unless some people might think that if you're going to a day program and they're providing your transportation, but usually that's coming out of the total budget that they're providing, so they're going to either provide you less hours or less services at that day program. And some of the changes that might actually be included in the cost of attending the day program. So, but taking any type of transportation and really trying to travel, there are costs and expenses to it, unless you're going to walk or you're going to have a bicycle that you can maintain yourself. Thank you.
Cecilia and Lois, thank you so much. And on behalf of the Family Support Center of New Jersey, Transition Matters, and to everyone in attendance on behalf of Cecilia and Louis, we would like to thank you for joining us this afternoon. Please feel free to explore future transition webinars at transitionmattersnj.org. And if you are interested in listening to this session again or any of our past webinars, you will be able to find the archive sessions on the Family Support Center of New Jersey website. That is fscnj.org, and that will be under the category of training and events. Cecilia and Louis, thank you again as always.
Very good.